According to the Lancet report on Global Burden of Disease 2019, mental disorders are increasingly known as leading causes of disease burden. This issue is particularly salient in Nigeria and in sub-Saharan Africa in general, where the need for mental health services is great but resources are limited. While mental health is viewed as an intangible and isolated issue, thus leading to lack of mental health policies, coherent programs, or action plans to address mental health challenges in many African countries. However, in many cities within Nigeria, people who are mentally ill and homeless suffer the most severe forms of penalty, often being without shelter, food, care, and clothing, and are usually exposed to various forms of human rights abuses. To address these needs, the Methodist Church Nigeria, in collaboration with Sister Rosalind Colwell, established the Amaudo Center for Mentally Ill Destitute, now known as Amaudo Integrated Community Mental Health Foundation, in 1989 at Ben, the local government area of Abia State, Nigeria. The Methodist Church Nigeria, through Amaudo, implemented a rehabilitation program solely for this population with the primary goal to provide mental health care to the homeless mentally ill people without any financial or social support with African community setting, and has also exposed them to various skills acquisition program while undergoing rehabilitation. Interestingly, the center has brought hope to some families in Nigeria who have limited options for mental health treatment by picking, rehabilitating, discharging, and reuniting over 2,000 mentally ill persons with their families free of charge.
We also observed that there are some persons who are on the streets due to drug-induced mental health problem. And I think it's a challenge to society because of the increase in drug abuse. We are emphasizing that there are mental health clinics in the local government areas in Abia State, and people should use them, especially at the onset of mental illness in any of their relatives in the society.
Also, in a bid to bridge the gap in accessing formal mental health services, the Methodist Church Nigeria scaled up the Amaudo Rehabilitation Service by flagging off the Community Mental Health Program, a program in partnership with the Abia State Primary Health Care Development Agency, with the aim of providing accessible, affordable, and acceptable services for people in rural communities in need of mental health care and their families across Abia, Imo, Ebonyi, and Anambra states, with 73 nurses providing care to over 6,000 people so far.
This year we are going into more of awareness through media awareness and in some strategic places. And we are also going to rehabilitate about 30 people this year. We are engaging in picking 30 people off the streets. Of course, you know it's not easy to rehabilitate 30 people and trace their homes and then reunite them with their families. But the community mental health program, which is ongoing in all the local government areas in Abia State, is what we are encouraging people to use so that those who may not be on the street have no business, because of neglect coming to the street.
With these achievements made, there is no doubt that greater successes will be recorded in the nearest future. To God be the glory.